Hi, welcome back to Heart of Gold. I am Paul Chartier. You have probably heard of Surgery on Sunday. We have the founder, Dr. Andy Moore. Good to have you.
Thank you.
The new executive director, Amanda Ferguson, and the head of the board, Paul Carney. Thanks for coming. You've been
Thank
here before.
you. I have been here
You're
before.
a veteran.
Yes. Yeah, I'm a veteran of Heart of Gold. I am. Yeah.
You're a veteran of Surgery on Sunday. Tell us how it got started, Andy.
Well, it all started in September of 2005. We'd been thinking about it for a couple of years before that to figure out how we could take care of the indigent population in Lexington, and there was just this huge need, and I had this sort of vision, but I really didn't have all the tools to get it done. And eventually I surrounded myself with enough people that could do the things that I couldn't do, and we got it started, and it's been very successful and it's very enjoyable.
Is it like clockwork every month, every week? How often does it go?
Well, we started off doing it once a month, and when Obamacare came along, it got a little confusing, and the population, before Obamacare, we had 1,500 people on a waiting list. And when Obamacare came on, our criteria was you had to have insurance, and if you didn't have insurance, then you were eligible for us. When Obamacare came along, they were sold policies that they had insurance, but they had these deductibles of $7,000 for an individual and $14,000 for a family. So we had to rework things, and so there was a little bit of a lull in the numbers, and so we went to every other month. And now we do it almost every month, but every once in a while we do still have lulls, and we don't want to just have a bunch of people come in and volunteer for a Sunday where we're just doing 1 or 2 patients. We typically like to do 10, 15 patients in a Sunday.
And Paul, where do you do the surgeries?
We do them at Lexington Surgery Center, which is over at Kentucky, right across the street from the big St. Joseph's Hospital. Yeah. And it's a great outpatient surgical center. It works out great for us, and runs just like a regular outpatient surgery day. It's really well done.
You're the head of the board. Do you also do surgeries?
Yeah, I've been part of the program since Andy started back in 2005. So, and I try to make it every Sunday. You know, we'll skip a few here and there for family stuff, but I pretty much make it every time. And we now have over 300 volunteers that help us with it.
The logistics must be, and Amanda, you're fairly new.
Yes.
You've been with your organization how many minutes?
I haven't counted the minutes, but about 6 weeks.
Okay.
Yes.
So you're ramping up.
Yes. And
what's your first glance exposure to the logistics and genius of what these folks do?
Right. Well, I mean, I have admired the organization from afar, and am thrilled to be on the inside now. But basically, just these people want to help. You know, we do have a regular surgery day, the 3rd Sunday of every month. But I'm learning that we're getting all kinds of different requests. I mean, people have heard about us and that know we want to help. And I mean, these 2 gentlemen here are perfect examples of that. But like Dr. Carney said, we have, you know, a long list of surgeons who want to volunteer. And just today got a request for an MRI, a person that needs surgery, and his insurance will pay for the surgery, but won't pay for the MRI, and the family can't afford the MRI. So, you know, that's something that I'm going to ask our clinical staff here to evaluate and see if we can help in that way. I'm just learning that, you know, there are a lot of different parallel processes, I guess, that are coming alongside not just the surgery, but dental care, colonoscopies. We have a list of patients needing cataract surgery, and just everywhere I'm surrounded by people who just want to help, and that's been amazing. So,
I know you're a very quiet, humble person. You've received some great awards and recognition lately. Talk about those.
Well, when I say that I've received them, I've taken them on behalf of Surgery on Sunday. This is not a program that you run by yourself.
I understand that.
You know, we were recognized by People magazine. We were recognized by ABC News, CNN Health Heroes. We've got the Governor's Cup. We've gotten the Fayette County Health Award. And most recently, we got the Muhammad Ali Humanitarian Award, which was really a neat thing. It was actually his last public appearance was that program, and it was a real honor to be part of that.
Is it almost bad to have all this good publicity and exposure to let people know that you do this free service and that they run to get things done, or how does that work? Because the waiting list must be a mile long.
Well, we serve we probably serve 3 or 4 states regionally. We have patients from southeastern Ohio, Kentucky, West Virginia, some from Virginia and Tennessee. The patients go to their provider or to a health clinic, and they're referred in with a surgical problem, and then we refer them out here to our volunteers who evaluate them and determine whether they're candidates for an outpatient operation. Along the way, there's lots of things you need to do. Sometimes they need diagnostics tests, sometimes they need preoperative medical evaluations, and we try to accomplish all that at no cost for the patient. And then if they're viable candidates for outpatient surgery, we schedule them and we take care of them. So it's a lot of people making a lot of phone calls and doing a lot of different things to get it to run right. And we've expanded, so we're now taking on dental care, which we didn't do before, and we're trying to integrate that into the community. We have plenty of volunteer dentists who want to help us, so we're going to take advantage of their altruism. We have ophthalmologists, but they want to operate at their surgery centers, so we refer those patients out and they schedule them into a regular work week. And we now integrate with baby health. We do pediatric surgery, and so it's a pretty remarkable thing, and it keeps growing. The idea really is to, for lack of a better term, is to franchise this to other places in the United States, because we're really a unique program. There aren't many of these. There's one in Louisville. There are some others akin in the United States, but not quite what we do, and the idea would be to provide these and at least provide a template so that people can do this in other communities. Because it's a necessary thing. No matter what happens, the government and private insurance companies are never ever going to be able to provide coverage for everyone. It's just never going to happen. You're always going to have people that slip through the cracks. And there has to be some safety net that catches them. And hopefully we can sort of spread our template to other people so that they can do that.
You guys save lives. Do you get a different sense of accomplishment on these Sundays instead of what you do during the week?
No question about it. It's you know, that handshake, the thank you that you get is very meaningful, and you really know that when you've left that day that you've changed somebody's life that otherwise would not have been changed. And you're not only changing their lives, you're changing the whole family's life, you know, because everybody's caught up in it. And it's extraordinarily rewarding. And as Paul says, he goes almost every Sunday, and I do as well, even if I'm not operating, because you're around a bunch of enthusiastic people that are taking care of these things. And just to feel that joy that everybody's feeling is just, it's hard to duplicate.
Christmas on Sundays. Do you have needs? Do you need supplies? Do you need money? We're going to give your website and phone number if you'd like to.
Well, we can always use money, you know, and we do take some supplies, but we're really not set up to take supplies and store them. Mostly get those donated. You know, if we need something that's very expensive, we will ask the vendor if they would provide that. And they've been very generous to this point with doing that. And so that side of it's working out. And you know, again, as Paul was saying, we want to try to franchise this thing and grow it across the country, because that would be a very meaningful thing to other communities. And so part of that would be even to maybe provide some seed money if we get deep enough pockets.
And Amanda, would you
That's
like to
good.
give the phone number and the website?
Sure. Our website is www.surgeryonsunday.org, and our phone number is 859-246-0046.
And that'll come to you,
Yes.
and then you have the fun of coordinating and trying to corral this whole situation every week. And I can't even imagine the logistics to line everything up, which is an off-site for everybody, and then have this happen. On these particular Sundays, do you have your specialists show up in that particular discipline to work on eyes one Sunday, hips some other Sunday?
Our program generally is a lot of general surgery. We do a lot of hernias and gallbladders, but we have ear, nose, and throat doctors. We have orthopedic surgeons. We have eye doctors. We have the neurosurgeons. We have a very broad spectrum of people that come and provide us. The anesthesiologists have to be there. But probably for every doctor that's there, you need 5 other people backing them up. You know, you need nurses, interpreters, people that are checking people in, you know. And one of the things that was very humbling for me when I got this started was I didn't realize how much effort goes into getting me into the operating room in the morning. And it gives you a huge appreciation for everything that takes place days before you even step in the room.
Yep.
Well, and even before our surgery days, I mean, in the office we have nurses who volunteer and will do pre-op calls with our patients, and you know, again, prepare all that for our surgeons. And
Logistics are huge, but you gotta remember these people are, many of them, very poor, and sometimes we have to get transportation for them.
Provide a
Sometimes
room.
sometimes we have to provide a room for them. We don't charge them for anything. You know, all of our donations really go to caring for the patient. That's where our donations go, for running our operation and caring for patients. We only have one paid employee, Amanda, and everybody else volunteers their time. We have volunteers that come into the office, answering phones, taking messages. So it's really a pretty remarkable thing. And like Dr. Moore said, I think one thing, when we get enough money that covers our expenses, we can certainly then move towards providing seed money for other organizations, because you do need some startup funds. And if I recollect, I think it was Good Samaritan that provided our initial.
No, I know initial money was provided by St. Joe Hospital.
St. Joe Hospital provided
It was
something
like $120,000 to get us going for 2 or 3 years.
And in the last minute, is there anybody you want to thank right now? Because this is going to be a link that you can share with everybody. And to mention anybody, would you like to mention anybody?
Well, yeah, all the people that do support us. Rotary just had a big fundraiser for us. We have lots of community things that people do. You can get on our website and see all those people that do, and they're very important to us.
We have great donors, we really do. Mount Brilliant Farm sponsors a race for us, and Josh Bowen, who runs a small fitness outfit called Aspire Fitness, does a 24-hour marathon workout session for us that generates a lot of money. So we have a lot of people that contribute, and our volunteers who come in rain or shine any day to help us take care of these patients is pretty remarkable.
You guys are the faces. You've got a new face, but for all the people that also prepare and help, the nurses and everybody else, you guys do a great job.
Thank you.
Thank you.
Great
Good to do
idea,
that.
great implementation, great choice to join a great organization. I'm Paul Chartier. Thanks for watching on Heart of Gold.